With borders closed, states locked down, families kept apart and people dying alone, this is not the Australia we thought we knew. Bit by bit, as insidiously as it's been transmitted through the community, this virus has been infecting our government.
Let me make it very clear, I don't make those decisions. I said to the Prime Minister I would refer it to the Chief Health Officer, and I did that.
Why did you let your money stay?
No, they're under. It's actually her decision. Under the Act, it's her decision.
But they're not decisions that I'm in any way involved in, any way at all. They are decisions that the Secretary of the Department make, and there are many of those decisions made on any given day.
The last 24 hours really threw it all into sharp relief, didn't it? Despite this from the Prime Minister.
They've got to find a better way, those who have decided these measures are necessary, that they've got to find a better way to deal with the heart here. I mean, I've dealt with many premiers on many different issues all the time. I've dealt with the Queensland Premier on other issues. Sadly, today I didn't have the influence that I would hope to have. But Sarah doesn't get today back.
No, she doesn't.
She never gets it back, and that just fills my heart with sadness. I don't really care what they say about me. It's not about me. It's not about her. It was about Sarah. It was about Isabel. It was about Myrna, and it was about Bernard. That's the only stuff that mattered today. I mean, it wasn't about borders. It wasn't about whether they should be up or down. It wasn't even about jobs today, and jobs are incredibly important, as you know. But this was just one day I had hoped that something different could be done.
These pictures today, how one of our own was forced to farewell her father, banned from his actual funeral and accompanied to a very brief viewing of his body by police lest she approach, hug or even speak with her mum or her sister. Here is Sarah speaking today.
It was really strange being in a funeral, and that time of, saying goodbye, I couldn't even get the support from mum and, my sister. It was just like a wave from afar, which was really hard. So I tried not to look at them to sort of not break down in the process.
Not even confident she could look at her mum and her sister. My God. 6 months ago, our big challenge was this pandemic. Now our big challenge is government. Politicians on a power trip of rules, restrictions, and the degradation of democratic liberties that's now making the cure worse than the disease. In today's media conference lecture, Victorian's Premier Daniel Andrews told us that there are just over 1,000 active corona cases, with 140 people in hospital, 12 in intensive care and 8 on ventilators. Now that's bad? Of course it's bad. But does it really justify keeping 5.5 million Melburnians under virtual house arrest? Does it justify turning Victoria into a virtual police state, with more than 400,000 instances now of police checking up on people who are just going about their daily lives? Especially now we know that the curfew has nothing to do with health advice, and indeed nothing to do with any police advice.
Has the government ever introduced something without your advice or against your advice?
No, not against my advice. The curfew came in as part of the state of disaster, for example. It wasn't a state of emergency requirement. So that was something that was introduced, but it wasn't something that I was against from a public health perspective.
But were you consulted on it or not?
Yeah, I was consulted on it, but it was a separate decision-making pathway.
Were police consulted about the introduction of a curfew?
No.
Were you at no stage?
No. The reality is I was never consulted. I've made inquiries to determine if anyone within the organisation was briefed on the matter, and as best as I can work out, our policy area was provided a copy of the proposed guidelines for our information a couple of hours before they were signed off.
And even the supposed experts the Premier's relying on say that lockdowns could all be going too far. Today, even the Victorian Health Minister came out of hiding to admit that the lockdown is causing other life-threatening health problems, like delaying cancer treatments. And don't get me started on the madness of the Queensland Chief Health Officer making more decisions than the actual elected MP, who is their health minister. Not just that, she's now the chief economic advisor, she thinks, in Queensland as well.
And whether that's the AFL, the NRL, whether it's swimming, tennis, all of the sports, cricket, I've recently, because we're coming into that season, whether it's any of those, whether it's entertainment industry, film industry, whether it's agriculture, whether it's resources and mining, construction, anything that will benefit our community, because I actually believe that the economy has an enormous role in determinants of health and the health outcomes.
Meanwhile, outside of Australia, instead of trying to do the impossible and eliminate this virus as the Victorian government is, the rest of the world's gritting its teeth and learning to live with it until and if we get a vaccine. Despite 3,000 new cases a day in Britain, equivalent to about 300 new cases in Victoria, there's some modest additional limits on social gatherings, but Boris Johnson is encouraging people to get back to work and to live normally. The Victorian Premier says that his lockdowns are the only way to save lives. Yet despite the world's toughest and now longest lockdowns, Victoria's death rate per capita, well, it's worse than Bulgaria, Kazakhstan, Turkey, Ukraine, Hungary, Slovenia and Costa Rica. Now, none of those countries can match Victoria's first world hospitals. In fact, as my colleague Rita Panahi noted in a newspaper column this week, the death toll in Victoria is more than twice the death toll in Egypt, Finland, Poland, Croatia, Greece and many other countries who have had nothing like the curfews and lockdowns and loss of liberties that Victorians have. What's happened here is that rather than making sensible and sober decisions like closing off our international borders at the start of the year and hotel quarantine for international incoming travellers, many of these premiers have pandered to virus hysteria to shut down parliaments, to boost their short-term popularity. In the case of the Queensland Premier, hoped that the last few years of bad government would all be forgotten when they go to the polls next month. Because of this, we've now ended up as a country with double-digit unemployment, debts that will take a generation to pay off, our first recession in 30 years, all for a virus that so far has killed hundreds fewer Australians than our annual road toll, far less than our usual flu season. I know the hardest thing for a leader is to change course, but when circumstances change or when knowledge changes, actions must change too. Without dropping our guard against this virus, there are lots of leaders around the world who are getting their countries back on their feet. We need to do that here in Australia. First, drop the Melbourne curfew now. Second, in Victoria, set up a recovery commission. Give everyone who needs a seat at the table a chance to help Victoria get back on its feet. Third, open up the Queensland border to people from New South Wales. And fourth, bring back some compassion into our decision-making. None of these things will end the pandemic, but it will bring some overdue common sense to dealing with it.